last week. Transportation Services and Toronto Public Health are working together on a plan to provide more space for pedestrians, cyclists, and transit riders to allow for better physical distancing. I've recently been briefed on this plan. I've pushed staff to come back with more aggressive timelines and more streets. I've also asked them to reach out to local councillors affected to talk about other specific streets. We will report on the plan in the next few days, but I would like to provide you with a high-level update on the early parts of it today. ActiveTO, as we're calling the plan, is about making sure that people have space to get outside, have space to get around while respecting physical distancing, and when it comes to some of the larger bike infrastructure projects, that we have a safety valve when it comes to the TTC. The ActiveTO plan will create more quiet streets. These will be local routes with traffic calming measures implemented very quickly as to enable local car traffic only and open up more space for cyclists and pedestrians. These routes will be chosen in areas where there is a lack of park space, or conversely, in areas where the routes are close to large parks so as to help alleviate congestion in the parks themselves. These quiet streets will roll out fairly quickly, and our initial target will be 50 kilometres of quiet streets. Oakland, Portland, and San Francisco are other cities that have already adopted similar quiet street projects. Secondly, as part of the ActiveTO plan, transportation staff and public health are recommending closing some major roads adjacent to trails or recreational attractions where we have seen major crowding on weekends and holidays. These are complete closures to all car traffic and would be delivered through recurring short-term road closures such as on weekends. Our staff are recommending closing off these roads completely rather than, say, a closure of one lane as a matter of safety for pedestrians and cyclists in these areas. We have done this before on weekends for a variety of events and situations. When this happens, on a trial basis, staff will be monitoring the entire experience, including the impact on adjacent routes, using real-time data, and we will make adjustments as necessary. Finally, we need more bike infrastructure to help people move around the city as the recovery and restart gets well underway. We will expand and accelerate key parts of the City Council's approved 10-year cycling plan, already approved by the City Council, and those parts connect up the network and fill in gaps, but they're also in areas that mirror TTC routes. We know we will need a safety valve for our transit system because some people may be hesitant to ride the TTC for a period of time for health-related reasons. Some of these cycling routes are still being identified along with how they would be implemented as quickly as possible. Staff are speaking to local councillors first so that they can be involved in these changes and engage local residents, and we will have more to say on this again in the next few days. I have urged staff to embrace this opportunity to build out the already approved bike network and to recognize this all needs to happen at an accelerated pace. While some bike lanes will be temporary, and those locations will also be announced next week, we will also be pushing ahead with the already approved, council-approved 2020 cycling network implementation projects, including Bloor Street West, Borden Brunswick, Douro Wellington, Argyle Street, Dewson Roxton, Shooter Street, York University and Downsview cycling connections, the Eglinton West Trail, the Highland Creek Trail, the Don Mills Access Trail, and the East Don Trail. Because these are constantly changing times, again, we will also watch the data closely and be ready to adjust and expand our plans as needed. This continues the good work we've been doing as a city throughout the pandemic, following public health's advice and responding to people's needs. We are going about everything we are doing in a responsible, common sense way, with public health, transportation services, and local councillors all involved in making common sense, health-focused decisions which broaden out our transportation network for a post-pandemic world. We are working to help people as much as we can in the city government and through the city government now and in coming months. Many have described the last 8 weeks as the end of the beginning. I agree with that. The beginning of the war against this virus is ending. It's not over yet, but it is nearer to the end than to the beginning. But there's a long road ahead of us to get back to anywhere near our normal lives. To quote another quote of Winston Churchill's, "It will take the blood and the toil and the tears and the sweat of all of us to take on the degree of personal responsibility that will form such an important part of a successful recovery." But I'm confident that Toronto will get through this, just as we found new ways to work and come together as a community over these last 8 weeks. We're finding new ways to live with the threat of this virus, and at the same time to make sure that our lives and our city can adapt and change as required, so that we can maintain our hard-earned status as one of the world's most successful and livable cities. That is the goal that we seek. That is the goal we're working hard to see that we achieve, to maintain our hard-earned status as one of the world's most successful and livable cities. And on that note, I will ask Dr. Davila to give her report for today.
Thank you, Mayor Tory, and good afternoon. In today's update, there are 217 new COVID-19 infections in our city, and sadly, 35 new COVID-19 related deaths. In total, there have been 6,019 confirmed cases and 646 probable cases. There are currently 391 people in hospital, 99 of whom are in intensive care units. I continue to hear stories of the 504 friends, family members, and other loved ones whom we have lost to this virus in our city. And there isn't a day that goes by where I don't reflect on these tragic losses. On behalf of our team, I extend my deepest sympathies to those who have lost loved ones and wish a speedy recovery to those who are sick. Last week, we started to see the number of new COVID-19 cases in Toronto slowly decrease. This is promising news, and it brings me hope. While you may think that washing your hands and practicing physical distancing are small efforts on the global scale of the challenge that we are facing, these measures are exactly what is needed to win this battle. It has been 7.5 weeks of physical distancing in our city, and I know that this continues to affect us, each and every one of us, in countless ways. We all want to move forward and get our lives back. At this time last year, we were getting our gardens ready. Bars and restaurants were preparing for a busy patio season, and we were enjoying time with our families and friends in our city's parks and other outdoor spaces. It was 23 degrees in the city, and the sun was shining. Everyone was excited for summer. Fast forward to today, and our lives have changed significantly. We are certainly living and facing an unprecedented new normal as we live through this global pandemic. The decreasing number of COVID-19 cases represents your commitment to our public health measures and to protecting our city, your friends, and your family. It gives me hope because I know you are all taking care of each other and finding ways to cope in these extremely difficult and unique circumstances. This also demonstrates our ability as a city to come together and work through extreme challenges that none of us has ever faced before. While COVID-19 has drastically altered our lives, and tragically, we have lost too many of our friends, family members, and other loved ones to this virus, thus far, we have averted what could have been much worse. If you had not done your part, we could have been experiencing similar tragedies seen in other parts of the world. But we are not out of the woods yet, and we need to remain diligent and focused. As I shared yesterday, now that the nice weather is upon us, I know that we all want and need to spend time outside. Today, I am pleased to share some of our further plans to make more space available for walkers, joggers, and cyclists. We are doing this so you can get outside and stay active as we continue our efforts to fight COVID-19. The World Health Organization has urged, wherever feasible, to consider walking or biking when moving around during the COVID-19 outbreak. These modes of active transportation not only provide physical distancing, but can significantly reduce our risk of chronic diseases and improve our mental health. We know that COVID-19 spreads through contact with the respiratory droplets of someone who is infected with the virus. These droplets can spread up to 2 meters or 6 feet, and we know that close, prolonged contact creates the highest risk for infection. So what does this mean? Well, this means that the risk for becoming infected with COVID-19 while passing someone on the street, walking trail, or bike path is low. So when you are out, running, or walking about, please step aside or pass others quickly and courteously. We know that mobility is key to recovery. This is why, as our recovery process begins, we need to keep Toronto moving. As you've just heard in Mayor Tory's update, we at Toronto Public Health are working with our colleagues in the city's Transportation Services Division on a plan to provide more space for pedestrians, cyclists, and transit riders so we can move around safely in our city. We know that how we live and move in our city impacts our health each and every day. Active transportation is more significant than ever as a result of COVID-19. This is why I look forward to leading this important work with my city colleagues and making progress as quickly as possible. In closing, I know that we are all anxiously awaiting the day when we can get our city back. Your personal sacrifices have started to result in positive milestones. But we need to be careful not to undo our progress. It is the job of public health to balance measures meant to control the spread of COVID-19 with the health, social, and economic consequences of those measures, with the overall goal of protecting the health of our city. I know that we can and we will continue to work together to win this battle. So please do continue to stay safe. Please continue to practice physical distancing when you go outside. And please continue to take care of each other. I will now hand it over to Chief Pegg.
Thank you, Dr. Davila, and good afternoon. As Mayor Tory explained, we recently learned of a number of forthcoming changes within Toronto. Immediately upon becoming aware of the most recent details, our teams, including our Emergency Operations Center, responded. As I have explained in the past, the incident management processes in Toronto are both nimble and scalable, and we have been successful in establishing a number of proactive solutions in anticipation of changes like these. This includes the establishment of our ActiveTO program that is already in place in 10 locations across Toronto, with more than 80 other locations under development. We have convened a number of teams to assess the impacts associated with the forthcoming changes and to build the response plans required to implement these changes in as safe a manner as possible. Each of the affected city divisions and agencies are fully connected and are working together on these important issues. This includes each of our emergency services, police, fire, and paramedic services, along with transportation, the TTC, economic development, municipal licensing and standards, and of course public health, to name but a few. Our team in the EOC is working in direct collaboration with Toronto Public Health in order to understand the public health measures that will be required to protect our residents and staff. Our PPE task force remains hard at work, and we will continue to proactively manage all aspects of PPE in order to ensure that the needs of our frontline workers are met. This, of course, includes comprehensive reviews by our employee health and safety teams, who are also hard at work to determine any changes in process that may be required. Our transportation services team, along with police, fire, and paramedics, are determining how best to implement citywide curbside pickup while maintaining both road and pedestrian safety and ensuring that our first responders are able to respond to emergencies in a safe and efficient manner. As this issue evolves, our strategic command team continues to meet no less than daily in order to ensure that the City of Toronto's response to COVID-19 remains timely, coordinated, and effective. Both our Emergency Operations Centre and our COVID-19 Task Force are fully engaged and will continue to respond to the ever-changing nature of COVID-19 in our city. The response to COVID-19 is the most significant emergency that our EOC has ever had to manage, and our operations continue on an uninterrupted basis. Today is day 57 of continuous EOC operations. Finally, as many have now likely seen, there is a family of foxes living at the beach. To protect both the foxes and the public, city staff have put up barricades to help protect the animals. We have also deployed city staff to this area to assist in educating people to stay away from the foxes. Please do not disturb wildlife in the city, either by handling or attempting to feed them. The experts tell us that this can have negative consequences on the health of the animals and can be dangerous to do so. In accordance with the Fish and Wildlife Conservation Act, wild animals are only relocated if they are injured, and then in order to allow them to recover. As this is not the case, our family of foxes will not be relocated. The foxes are doing well, and we wish to keep it that way. In closing, I am extremely proud of each and every member of our City of Toronto team who are working, often around the clock, in response to COVID-19. Now more than ever, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, just so reporters know, on the line we have Barbara Gray, General Manager of Transportation Services, Marianne Bedard from Shelters, and Paul Raftis from Long-Term Care. First question is to Lucas Meyer from News Talk 1010. Lucas, go ahead.
Thank you very much for taking our questions once again. Mayor Tory, so you said that if recommendations are needed, then you'll give them. But the plan is for Monday. So, I mean, you mentioned quickly there a super long lineup. Let's say a curbside retail location opens and you just get a massive lineup in the downtown on one of the major streets. Who's responsible for that? Is it by law? Is it going to have to be the province that mitigates that? Is it a business themselves? I mean, if you have a massive lineup of people, how's that going to be handled?
Well, first of all, from our conversations with business, there's not an expectation there are going to be massive lineups. A lot of these very same businesses have carried on online commerce during the time of the shutdown. And secondly, I think that the province indicated today that the opening and curbside pickup was within the context of other existing provincial regulations, some of which are being continued. And finally, when it comes down to that question of who will be responsible, it will be the city that will be responsible, but I think we'll be doing it in partnership with business, and the businesses that have been open during the course of the emergency have proven themselves very much able, in the vast majority of cases, to do an excellent job of setting out places where lineups can take place, ways in which people can be spaced apart in those lineups, regulating the number of people going into the stores. But I've said that we will watch this very closely, and if there are problems, we will do what needs to be done in order to place health first and make sure people are appropriately physically distanced from one another.
Does that include that you might, if you do see problems in particular parts, say, for example, of the downtown, that you may recommend to the province, we can't do it on this particular stretch of road, for example?
Well, I think we're going to have to do our best to put forward a plan, and that's the plan that Chief Pegg referred to. We got at last night as soon as the Premier called me to tell me of the decision taken by the Cabinet, and we're hard at doing that plan. We had a head start in something like ActiveTO, which took account of hotspots that existed before for people coming and going from stores either on foot or in their cars, and we will proceed to do that kind of work on a case-by-case, place-by-place basis, placing health first and making sure that we do whatever we can to keep people safe and to keep them healthy and to allow these stores to begin this early stages of reopening for business.
Okay, thank you. We go to Catherine Brulot now from Radio Canada. Catherine?
Hi, thanks for taking my question. The City of Ottawa has removed some of the restrictions on the use of parks and green space today. Can Torontonians expect some of the restrictions that are in place here to be lifted anytime soon?
Well, in fact, I'll tell you that Mayor Watson called me over the weekend to get our advice because he was mindful of the fact that we had not closed our parks. We had closed amenities inside parks, and they continued to be closed. And they were closed for public health reasons related to the fact that, for example, playground equipment could contain traces or keep traces of the COVID-19 virus on them, and it was just deemed to be safe as well from the standpoint of physical distancing of children who often don't understand these kinds of things. And so I think we're in a position which is not dissimilar to where Ottawa is after their changes, but we're reviewing all of these things on a day-to-day basis, starting with the most important premise, which is that we have to be heading in the right direction on public health and on COVID-19 concerns, and we'll be very much guided, as we have been in all of these decisions, including the ones to close those recreational amenities, by the advice of the Medical Officer of Health.
Follow up, some of the people that are most affected by this are children on the autism spectrum, and a group of parents in Toronto are looking into what's done elsewhere to try and alleviate the burden of everything that's going on. They found, for example, in Italy, some parks that were open on a schedule for kids, especially with autism, and family would be able to go and use the play structure for a set amount of time, then clean it up, then the next family would be able to go. And they're now working towards trying to make that happen either on public parks or maybe private playgrounds. Is this something that the city would look into?
I can only say to you that I think people are well aware of my long-standing interest in and support for families affected by autism, and my now personal concern with it within my own family, and that anything like that that fit within the imperatives that we have to address when it comes to public health and containing and eradicating the spread of this virus, I would say we would consider it. It sounds like a reasonable kind of thing to look at within the context of a gradual reopening of some kind of different facilities. But so I wouldn't rule anything out. I would just say that that kind of idea has not been presented to me before now, and I certainly would be prepared to discuss it with our park staff and, of course, with our Medical Officer of Health as part of what we do to adjust ourselves to evolving realities.
Okay, thank you. We'll go to Matt Bingley now from Global News. Matt?
Hi, my question is for both the mayor and Dr. Davila. The city has been criticized by many for being much slower when it comes to opening up bike lanes or allowing more active transport transportation for pedestrians. Why now? What has actually changed to actually make you shift your tone on this?
There's a difference between myth in reality, and there have been a number of announcements made in other places, including in cities in Europe, for example, where they are at a much different stage of the pandemic than we are here. And so it's logical. But I was on a teleconference this morning with about 40 mayors from around the world, and I can assure you that a lot of them have made announcements and have indicated things are going to be happening. But when they gave an update this morning, a lot of those things are still at the stage of projects that have been announced but not yet implemented. And the same is true in other Canadian cities. There were Canadian mayors on this teleconference this morning. I will say to you that I indicated here, just to go back, on March 23rd, it was written up in the Globe and Mail that we were going to be looking, and we'd asked public health staff and transportation staff to look at ways in which we could keep pedestrians safe in a sort of post-pandemic world and in later stages of this. I appeared here in April and said to you that no option was off the table. And so we've had staff in public health and transportation working on a plan since then and throughout that period. They've come forward with that plan to initially brief me, as often happens with these kinds of things. And we're moving forward with the elements of the plan, some of which I began to outline today. So I think we are consistent with our where we are with the virus overall and the pandemic overall, entirely in a place. There have been some who thought we should, they had random suggestions at the beginning, like close Yonge Street. It seemed to bear no relation to where there might actually be a problem, because Yonge Street, even as shown on television the other night, had not a pedestrian on the sidewalks or a handful. So I think what we've done is gone about this in a common sense, thoughtful way. We've come forward with the first elements of a plan with much more detail to follow, and we are going to do what is in the best interest of the health and safety of pedestrians and people in the City of Toronto, and more details to follow.
And Mayor, I'm just wondering, last night, obviously you had a conversation with the Premier about some of the opening up. Are you satisfied with the level of consultation that the province has given you about actually opening up some of these retail locations?
We've had some good discussions, including last night, about the fact that Toronto, as much as I know it aggravates people in other parts of the province, that's been the case throughout Confederation and probably before that, that people don't like the fact that Toronto is a big place with many unique considerations that has to take into account. I always accompany that when we're having a little chat about Toronto by reminding people that this is the economic engine of the entire province and country, out of which comes a lot of the wealth that pays for things, happily so, to build a strong province. But it also has very dense population, it has very dense development, it has dense retail, and as a result there are just unique considerations that have to be taken into account when big decisions are made that affect the city, especially as it comes out of a pandemic where it has been acutely affected to a greater extent than most other parts of the province. And so those are discussions we've had, the Premier and myself and others, very directly and in a very candid and collegial way, and I trust that they will be mindful of that as they go about making their decisions, and we talk often, which is the good news. There are very few things that come by surprise.
Okay, thank you. We'll go to Stuart McGinn now from 680 News. Stuart?
Thanks, guys. Just Mayor Tory wanted to ask you about, as we approach, the May long weekend and Canada Day, we're seeing the city of Mississauga, they've actually banned fireworks for Canada Day, and they're also just telling people, please don't buy them. I'm just wondering if this is something that's on the city's radar, and if that's something you'd consider saying to residents of Toronto as we approach kind of both those periods of time where people like to use fireworks.
I'd have to think through the reasons why you would ban, for example, otherwise legal and safe deployment of fireworks by individual families, because I don't see it as immediately carrying with it any physical distancing issues or anything like that. And in fact, my approach with regard to fireworks displays in the city has been to search, in the absence of the ones that would normally take place at Nathan Phillips Square or Mel Lastman Square and Scarborough and Etobicoke, to see if we can search to find a place where we could have a terrific fireworks display put on that wouldn't attract a crowd, where people could see it from around the city, something like that, because I think it is a part of Canada Day. So I'm, at the moment, taking quite a different approach. I stand to be corrected on reasons why you would discourage individual safe setting off of fireworks in a legal manner, but at the moment we haven't been discussing trying to ban people from doing that. In fact, I'm trying to look for ways in which we could have a fireworks display that would celebrate our great country and its birthday, but without attracting a crowd.
Okay, thank you.
Okay, we'll go to Mark McAllister now from City News. Mark?
Mayor Tory, if you would, I'm just going to pick up on the questions that a couple of my colleagues have brought up with regard to the timing of all of this. You said you spoke with the province last night. Has this forced your hand on making sure that our streets are going to be safe and making sure that pedestrians have the space that they need once these stores open up?
nothing forced our hand with regard to making sure the streets were safe. I gave you dates a month ago, more than a month ago, where we indicated we were working on plans to make sure streets and pedestrians and cyclists remain safe and that no option was off the table. I've spoken about that several times here. It didn't happen to coincide with some of the calendars that were set forward by advocates, and I understand that. It's their right to put forward whatever calendar they want or pick streets at random out of a hat. We were going about preparing a methodical, careful, sensible plan. That plan is well along now, but not quite finished. I've indicated some of the elements here today, and we will proceed to do that just as we proceed to go along with the reopening and the recovery plans that are being put together by the city and by the province. And the objective has always been the same, and it will be the same going forward, which is to make sure that people stay safe and stay healthy as we open up the economy and have our city return as close to normal as quickly as we possibly can.
Dr. Davila, we still know that there are 2,000 approximately, give or take, active cases in the city at this point. Your message up until today has been stay at home unless you absolutely need to leave. That has changed very quickly. Why the sudden change?
So Mark, in fact, my message has been changing over the course of some time now. It's not a sudden change by any stretch of the imagination. There's been some time where I've been talking about the peak period and thinking beyond the peak period, moving from COVID response to COVID recovery. And so, in fact, the remarks I've made and the decisions that we're making at this point in time and the advice that we're providing is consistent as we move from COVID response towards COVID recovery and living safely with the virus in our community to the extent that we can do that.
Okay, thank you. We'll go to Derek Dionarain now from the CBC. Derek?
Thanks, Brad. This question is for Dr. Davila. So yesterday you identified that high-level data indicated there were areas with high portions of low-income earners and recent immigrants and high unemployment that had higher rates of COVID-19 hospitalizations. Which specific geographic areas or neighborhoods of Toronto have you identified where this is happening?
So our data team at Toronto Public Health has gone over and done that analysis for us. I don't have a complete list here for you, but we will be putting out data more and more so that the public can understand and that you, the members of the media, can understand what has been happening with our COVID-19 outbreak, what our experience has been here in the city, and from a local public health perspective, what we'd like to do with those data is to use them so that we can better inform prevention efforts on a go-forward basis.
And just to follow up, is there any light that you might be able to shed on what the rate in some of these neighborhoods compared to the general population is?
So not specifically at this time. Those are the kinds of data we'd like to put forward for public consumption and certainly for our use at local public health, as I said, to inform our efforts and our actions on a go-forward basis.
Okay, thank you. We'll go to Dave Ryder now from the Toronto Star. Dave?
Hi. Mayor Tory, I'm hoping you can parse for me a little more about what the plan is. It sounds like, I think 50 kilometers, and it sounds like maybe parts of roads in some places, and then full roads in others, but maybe on weekends. I know you aren't releasing the whole plan today, but can you tell us a little more, just so we're characterizing it accurately?
Well, so that we're clear, the 50 kilometers thus far is only for the quiet roads. So that does not apply to the roads that may be closed, that are more major roads adjacent to recreational and other kinds of places where we've seen some crowding. So those are yet to come, and they will be as described by you. They will be partial closures in some cases, and they will be announced soon. We're in the midst of kind of trying to sort out the logistics of that because it's slightly more complicated than the Quiet Streets program, which is simpler and faster, quite frankly, to implement. So it is a combination of all the things that you mentioned, and we will be able to finalize that and announce it in the next few days, and we will do so because we want to move forward with this and have it in a situation where, especially with some of the ones that are slightly more complicated logistically, we are able to keep up with the pace of recovery and the active transportation uses that people will want to make of those public spaces.
Okay, but just there will be full streets at some time? I just want to make sure that's true.
There are significant streets that are presently under consideration in the plan that would be closed on weekends in particular, and we're still looking at the rest of the list in order to determine, what takes account of the need of pedestrians and cyclists to remain healthy and safe, but at the same time reflects the need to keep the city moving and to have deliveries and to have emergency vehicles able to do what they have to do. So it's not a simple undertaking, as has been suggested sometimes when proposals have been put forward, but we're working hard at it. Our staff in both public health and transportation has been hard at it for weeks now, and the thing is evolving, and we'll be ready to have more details released next week, and that includes cycling infrastructure as well.
Okay, we'll go to Jackie Crandalls now from CP24. Jackie?
Hi, everyone. Thanks for taking my question. I just want to pick up on the unique considerations that you alluded to, Mayor Tory, for Toronto, the population, commerce, crowds, as alluded to by the Premier, especially in the downtown core. If you might give consideration to, or if you have thought about mandating the use of masks in Toronto.
No, again, that's not the kind of thing I would give consideration to. I would abide by the advice of the medical officer of health, and if she felt, I'm sure there were circumstances in which that would be appropriate and would help stop the spread of this virus, I'm sure I'll get that advice, and I would be willing to entertain any advice that she offered. What I'm hopeful will happen, actually, is that this whole next chapter involving the availability of curbside pickup from retail will not result in a lot of lineups, because retailers have been, many of them, staying in business online throughout, and they haven't built up a pent-up demand, that they won't act to create circumstances where we would have big lineups by having kind of blowout sales and this kind of thing, and we're going to be talking to them about that. So we will take the advice on both the business aspects and the health aspects as they come, and the transportation and safety aspects, because we have to take account of emergency vehicles and things like that. And that's why we're working with the business community, emergency services, public health department, and the transportation department all together, and we've been at work on this since we were notified of this last night and before, making up a plan that takes all of that into account and keeps people safe, gets business underway again in a moderate way, and generally moves the city forward.
Okay, and I have a question not related to the reopening of some businesses and crowds being out there. The situation at the city daycare, specifically Jesse Ketchum, do you have an update on that in terms of the number of children and staff infected? I know some were tested and those tests were pending. Do you have an update on that situation and the situation at large within the city-run daycares?
So I may take that question. The last update that I had was that with respect to Jesse Ketchum, there were 11 positive staff and 4 children, all diagnosed with COVID-19. But my understanding as well that they were all doing well and recovering without incident at home.
Okay, sorry, we're just going to go back to Dave Ryder. He had another question that we cut him off there. Sir, Dave, go ahead.
Yeah, thanks for that. Mayor or Chief Peg, I just want to clarify too and make sure that I understand for what you're saying about the provincial reopening announcement is that the city is not going to go its own way and say, no, some of those stores can't open. We're not following the provincial timetable. It sounds to me like you're saying we're going to kind of watch and wait, and we might introduce some rules like physical distancing if needed, but you are not preventing any of those categories of businesses reopening. Is that true?
I would say it is unlikely, but not impossible. It is unlikely that we would find a category we would not permit to open. We also have to take account of the relatively limited powers we have, which we discussed this morning in the context of our ability to legislate those things, either under public health or otherwise under a bylaw. And I would say that what we're going to spend our efforts on instead is trying to make sure that the very unique considerations, which I trust the province will take into account in all of the decisions going forward. It is a unique situation. People don't like to hear that, but the fact is we have very dense retail, a very dense and big population, and for that matter, we've been uniquely and acutely affected by the virus in a way that is not true in other parts of the province. So therefore, the risk associated with all this is greater. So I hope all of that will be taken into account, but our objective for the moment is to develop a plan that implements the provincial announcements made today, and that does that in a way that keeps Torontonians, businesses, customers, everybody safe and healthy.
Okay, thank you. We'll go now to Francine Copen. Last question from the Toronto Star. Francine? Oh, Francine dropped. Okay. All right, everybody. Well, that's it for questions. Thank you for joining us. We'll be back again tomorrow at 3:45. Have a safe evening.